Hello and welcome to Pregnancy Info. Pregnancy is a magical time filled with joy, hope, and new beginnings. But it's also a time to stay alert and deeply connected to your body. Not every discomfort is normal, and some signs, if ignored, can lead to serious complications. In this video, I am going to take you through 12 critical warning signs during pregnancy that you should never ignore. Whether you are a first-time mom or already experienced, this information can help protect both you and your baby. So let's get started. Number 1. Severe abdominal pain or cramping. A little discomfort in your abdomen is common as your uterus stretches, but sharp or persistent abdominal pain is not something to take lightly. It could be a sign of ectopic pregnancy. If it happens early on, this is when the fertilized egg implants outside the uterus. In the later stages, it might mean placental abruption, where the placenta separates from the uterus. It can also be a sign of preterm labor. If your pain is severe or doesn't go away with rest, see your doctor immediately. Number 2. Heavy bleeding or spotting. Light spotting can be normal in the early weeks, but heavy bleeding, especially if it's bright red and comes with clot or cramps, may be a sign of miscarriage, placenta previa, or placental abruption. Don't wait and hope it goes away. Always report any bleeding beyond spotting to your healthcare provider. Number 3. Persistent headache. Headaches can happen from hormonal changes or tiredness, but a headache that lasts 4 hours or keep coming back could be a sign of high blood pressure or preeclampsia, a serious condition that affects both mom and baby. If over-the-counter painkillers don't help, the headache is accompanied by dizziness, nausea, or visual changes, it's time to see a doctor. Number 4. Vision changes. Pregnancy should never blur your vision. Literally, if you start seeing flashes of light, dark spots, or blurred vision, especially in your second or third trimester, this could be a symptom of gestational hypertension or preeclampsia. These issues can affect blood flow and put pressure on your eyes and brain. Immediate checkup is needed. Number 5. Swelling in face, hands, or eyes. Swollen ankles and feet are very common in pregnancy, especially in the third trimester. But suddenly, swelling of the face, hands, or around the eyes might mean your body is retaining too much fluid. A major warning sign for preeclampsia. If the swelling comes on quickly or looks unusual, don't ignore it. Number 6. Sudden or rapid weight gain. Some weight gain is healthy in pregnancy, but if you notice that you are gaining more than 2 to 3 kilograms in a week, and especially if it is accompanied by swelling, it could be due to fluid retention. Again, this is often linked with preeclampsia, which can be dangerous if not diagnosed on time. Number 7. Pain or burning while urinating. Pain, burning, or a strong urge to urinate often may point to urinary tract infection or UTI. If untreated, a UTI can turn into a kidney infection, which increases your risk of preterm labor. Don't feel shy about bringing up urinary symptoms. They are very common and very treatable. High fever. A fever over 100.4 degree Fahrenheit or 38 degree centigrade can indicate an infection. Infections like listeria, urinary infection, or COVID-19 during pregnancy can affect the baby's development or lead to early delivery. Always contact your healthcare provider if you experience a high fever, especially with chills or body aches. Number 9. Severe vomiting and dehydration. Nausea is expected, but if you are vomiting so much that you can't keep food or water down, you may have hyperemesis gravidarum. This is not regular morning sickness. It can lead to dehydration, weight loss, or malnutrition. You may need IV fluids or even hospitalization, so don't delay treatment. Number 10. Decreased baby movements. By the third trimester, most babies have a movement pattern. If your baby is usually active and suddenly become very quiet, it might be a sign of fetal distress. Try drinking something cold and lie down to count the kicks. If you feel less than 10 movements in 2 hours, consult your doctor immediately. Shortness of breath or chest pain. If you suddenly feel like you can't breathe, have chest pain or racing heartbeat, this could be more than pregnancy fatigue. It might indicate a blood clot in the lungs, pulmonary embolism, anemia, or even heart issues. Call emergency services if it feels severe or frightening. Number 12. Intense itching on hands and feet. Itching during pregnancy may seem harmless, but persistent or intense itching, especially on your palms and soles, could indicate a liver disorder known as ICP, intrahepatic cholestasis of pregnancy. This condition increases the risk of stillbirth and should be treated immediately after testing liver function. In the end, your body is constantly sending messages, some loud, some subtle. The key is to listen. If you notice any of these 12 warning signs, don't panic, but don't ignore them either. Early medical attention can make all the differences. Share this video with expecting mother and help spread awareness. If you found this video very helpful, give it a like, leave your thoughts or experience in the comments, and subscribe for more pregnancy and health related content. Take care and enjoy your journey to motherhood.